If your older dog is suddenly draining the water bowl faster, asking to go outside at night, or having accidents after years of perfect house training, those changes deserve attention. In chronic kidney disease, thirst and urination usually change before appetite, weight, or energy. But there is an important catch. The kidneys can already be damaged before you notice anything at all. So if we rank the 4 changes in the question, increased thirst is generally the earliest one an owner is likely to recognize. More precisely, increased urine production often happens first, and the increased drinking follows because the dog needs to replace the water being lost. Appetite loss, noticeable weight loss, and low energy tend to become more common as kidney disease progresses. But no single symptom can tell you that your dog has kidney disease, and the order is not identical in every dog. One reason kidney disease can be difficult to recognize early is that dogs have a remarkable amount of functional reserve. Chronic kidney disease usually develops gradually over months or years. During part of that time, a dog may look completely normal. Current veterinary guidance describes stage 1 chronic kidney disease as kidney damage without the typical outward clinical signs. Even in stage 2, many dogs still have few obvious symptoms, although their ability to concentrate urine may already be impaired. That loss of concentrating ability explains one of the most useful clues you can notice at home. Healthy kidneys do more than filter waste from the bloodstream. They also conserve water by adjusting how concentrated the urine becomes. As functioning kidney tissue is lost, that concentrating ability can deteriorate. The dog begins producing a larger volume of more dilute urine. More water leaves the body, so the brain triggers thirst to replace it. That is why what looks like a drinking problem may actually begin as a urination problem. Cornell notes that in many causes of excessive drinking and urination in dogs, increased urine production is what drives the increased thirst. You may never measure the water in ounces or milliliters. Instead, you notice patterns. The bowl that used to last most of the day is suddenly empty by lunchtime. Your dog stands at the bowl longer. Maybe he searches for another water source after finishing. A dog who comfortably slept through the night now wakes you at 2 in the morning to go outside. Walks include longer or more frequent urination. There may even be an accident indoors or urine leakage during sleep. Those are practical observations worth writing down because they can help your veterinarian understand whether something has truly changed. But increased thirst does not equal kidney disease. That distinction matters enormously in an older dog. Diabetes mellitus can cause increased drinking and urination. So can Cushing's syndrome, Addison's disease, liver disease, urinary tract infections, leptospirosis, certain cancers, and other conditions. In an unspayed female dog, a uterine infection, called pyometra, can also cause increased thirst and urination and may become life-threatening. Heat, pain, stress, medications, and less common behavioral causes can change drinking patterns too. That is why trying to diagnose kidney disease from the water bowl alone can send you in the wrong direction. Now consider appetite. Could decreased appetite be the first thing you notice in a dog with kidney disease? Yes, it can happen. But it is not generally the classic earliest change in slowly progressing chronic kidney disease. As kidney function becomes more compromised, substances that would normally be eliminated can accumulate in the bloodstream. This condition contributes to what veterinarians call uremia. In more advanced disease, uremia can produce nausea, vomiting, gastrointestinal discomfort, and a declining desire to eat. The result may be a dog who approaches the bowl but walks away, eats only part of a meal, suddenly seems unusually selective, or has good days followed by bad days. Appetite problems become particularly important in later stage kidney disease because inadequate food intake can accelerate weight and muscle loss. There is another reason not to use appetite alone as an early kidney test. Older dogs stop eating for countless reasons. Dental pain, gastrointestinal disease, pancreatitis, infection, medication effects, pain elsewhere in the body, cancer, and many other problems can reduce appetite. A senior dog who stops eating deserves an explanation, but kidney disease is only one possibility. Weight is even more complicated. A dog can lose kidney function without producing a dramatic change on the bathroom scale. Eventually, chronic kidney disease can be accompanied by declining body condition and loss of muscle. That weight change may reflect decreased calorie intake, nausea, chronic illness, dehydration, or loss of lean tissue. Merck specifically recommends monitoring not only body weight in dogs with kidney disease, but also body condition and muscle condition, because later stage patients are vulnerable to inappetence, weight loss, and cachexia. Muscle loss is especially relevant in an older dog because it can be easy to mistake for normal aging. You may notice that the spine or hip bones feel more prominent. The muscles over the back legs may look thinner. A collar or harness may fit differently. Yet those changes can occur slowly enough that someone who sees the dog every day does not recognize them immediately. There is also a diagnostic reason muscle matters. Creatinine, one of the blood markers commonly used when assessing kidney function, is influenced partly by muscle mass. A thin, older dog with significant muscle loss can therefore require a more nuanced interpretation than a young muscular dog. Another biomarker, SDMA, is less affected by decreasing lean muscle mass. Veterinarians may evaluate trends rather than relying on a single isolated number. Then there is energy. Owners often describe this simply as, "He's slowing down." That observation matters, but low energy is extremely nonspecific in a senior dog. Arthritis may reduce activity. Pain can reduce activity. Heart disease, endocrine disease, infection, anemia, cancer, poor sleep, and many other problems can make an older dog less enthusiastic about walks or play. Kidney disease can certainly contribute. Dehydration and the systemic effects of advanced kidney dysfunction can make a dog feel unwell. In later stages, the kidneys may also fail to support normal red blood cell production adequately because diseased kidneys produce less erythropoietin, a hormone involved in red blood cell formation. The resulting non-regenerative anemia can contribute to weakness, lethargy, and even decreased appetite. But again, these tend to be concerns associated with more advanced disease rather than a reliable first warning sign. This is where the story changes from watching symptoms to actually evaluating kidney function. If an older dog starts drinking or urinating more, a veterinarian will usually want much more information than simply whether the dog seems thirsty. A physical examination and history matter, including medications, diet, previous illnesses, changes in urination, vomiting, appetite, weight, and how quickly the change appeared. A sudden, very sick dog raises different concerns from a dog whose water consumption has gradually increased over several months. Acute kidney injury and chronic kidney disease are different processes and can sometimes overlap. Blood testing can evaluate markers, including creatinine, SDMA, blood urea nitrogen, phosphorus, electrolytes, and other measurements that help put kidney function into context. Urinalysis is equally important because the veterinarian needs to know whether the kidneys are concentrating urine appropriately and whether there are other abnormalities. A urine-specific gravity measurement helps answer the concentration question. Urine may also be assessed for protein, and a urine protein to creatinine ratio can be used when appropriate to quantify protein loss. Blood pressure matters too. Dogs with confirmed chronic kidney disease are assessed not just by a single kidney value, but through a broader staging and substaging process. IRIS staging uses kidney function markers in a stable, hydrated patient, while proteinuria and blood pressure provide additional information about risk and management. This is one reason two dogs both described as having kidney disease may receive different recommendations. Their stage, blood pressure, urine protein, phosphorus, hydration, appetite, and other medical conditions may be completely different. Depending on what the initial evaluation shows, A veterinarian may also recommend a urine culture or abdominal imaging. Ultrasound or radiographs can help investigate structural abnormalities, stones, obstruction, or other problems, while urine testing can help identify infection. Finding a treatable problem alongside chronic kidney disease can make a meaningful difference. There is also something you should not do while trying to figure this out. Do not restrict your dog's water because the drinking seems excessive. A dog losing the ability to conserve water needs access to fresh water. Limiting that access can increase the risk of dehydration. And if kidney disease is eventually diagnosed, do not assume that every senior dog should immediately receive the same homemade diet, protein restriction, phosphorus restriction, supplement, or fluid routine. Nutrition is an important part of managing diagnosed chronic kidney disease, and therapeutic renal diets can provide significant benefits in appropriate patients. But nutritional decisions should be individualized around the diagnosis, disease stage, laboratory results, body and muscle condition, appetite, and other illnesses. WSAVIA guidance emphasizes individualized nutritional assessment, while current kidney disease guidance recommends monitoring food intake, weight, body condition, and muscle condition over time. A useful thing you can do at home is establish your dog's normal pattern before there is a crisis. Notice roughly how often you refill the water bowl. Pay attention to nighttime bathroom trips. Know whether your dog normally finishes meals immediately or grazes. Check body weight periodically when practical. Run your hands over the spine, ribs, shoulders, and hindquarters so gradual muscle loss is easier to recognize. Changes over weeks or months can be more informative than a vague impression that your dog is simply getting old. And remember the first limitation. Visible symptoms are not an early warning system for every case. Chronic kidney disease can exist before an owner sees increased thirst, decreased appetite, weight loss, or lethargy. That is one reason routine veterinary examinations and laboratory monitoring become increasingly valuable as dogs age. Trends in creatinine or SDMA, changes in urine concentration, protein in the urine, or other abnormalities may provide evidence before dramatic outward illness develops. The second limitation is that symptom order varies. A dog with kidney disease plus another condition may lose appetite first. Another may lose weight gradually while drinking changes go unnoticed. Some dogs compensate surprisingly well until disease is advanced. And a dog that becomes dramatically ill over a day or two, repeatedly vomits, becomes profoundly weak, produces very little or no urine, or may have been exposed to a kidney toxin needs prompt veterinary assessment rather than being treated as a routine example of slowly progressing senior kidney disease. Acute kidney injury can present very differently from chronic disease. So, what changes first? Thirst, appetite, weight, or energy? For the typical older dog developing chronic kidney disease gradually, the best answer is thirst, usually together with increased urination, and technically often because the kidneys begin losing their ability to concentrate urine before the dog starts drinking more to compensate. Appetite loss, weight loss, and reduced energy generally become more prominent later as kidney dysfunction and its complications progress. But the truly earliest kidney changes may produce no visible symptoms at all, and increased thirst by itself cannot diagnose kidney disease.